Hello, everyone. Thanks for joining us today for what promises to be a very, very valuable and interesting discussion. I'm Ruth Levine, CEO of ID Insight and non-resident fellow at the Center for Global Development. We're really pleased to have you here today. It's a wonderful group of people. If we were all in the same space, we would be delighted to be together, I'm sure. We have a fantastic group of speakers who will all be weighing in on how to expand and unlock the full potential of evidence to policy partnerships. What we've seen with COVID-19, climate change, and many, many other issues of the day is that we increasingly need high quality and timely evidence. And we need advocates in government and outside of government to make sure that evidence is used well for public policy making. Impact evaluations are particularly well suited to many of the questions that face us because they permit us to estimate the net impact of the programs that governments fund. But what we've observed is even as the number of impact evaluations and even the quality has increased, there are gaps in their use. And we've learned over time how important it is to establish partnerships between researchers and evaluators and government to make sure that the work is relevant and used. So in response to the challenges that have been observed, the Center for Global Development several months ago established a working group led by Amanda Glassman and myself to consider how the next generation of investments in impact evaluations can increase their usefulness, their relevance and responsiveness to public policy concerns. And to inform the working group's deliberations, we commissioned a background paper by Abeba Taddese on the role of evidence to policy partnerships as a mechanism to strengthen the demand for and use of policy relevant evidence. So today we get to hear the initial results from Abeba's work. She is the program director of evidence-informed policymaking at Results for Development. And she's going to present some key findings on barriers that hinder progress and some recommendations about what can be done in a practical way to advance partnership models. Then we're going to get to hear in a kind of dynamic panel from three speakers, and we are just so honored and pleased to have them with us. We'll be hearing from Norma Altschuler, a program officer in the Gender Equity and Governance Program at the William and Flora Hewlett Foundation. We'll also get to hear from Michael Hiscox, who's professor of international affairs at Harvard and former founding director of the behavioral economics team at the Australian Department of the Prime Minister and Cabinet, who is also a member of the working group. And we'll be hearing from Konstantin Manda, who's co-founder and director of the Impact Evaluation Lab at the Economic and Social Research Foundation in Tanzania. He's coming to us from Dar es Salaam, and co-founder of the Network for Impact Evaluation Researchers in Africa. We'll make plenty of time for audience questions, so get them ready. You can submit questions throughout the event by commenting on Twitter using the hashtag CGD Talks, that's hashtag CGD Talks, or emailing events@cgdev.org. With that, let's start by hearing from Abeba. Over to you, Abeba.
Great, thanks for that, Ruth. I am going to share my screen and slides. All right. So yes, I'm excited for this panel and this opportunity to share some of these findings, and want to thank CGD for this opportunity, the working group, but also Julia Kaufman and Janine Modern Keller for really helping to shape this paper. And also a big thank you to the partnership leads and experts who took time out of their kind of busy schedules to speak with me, and for whom I really, got the sense that this topic and conversation around partnerships was sort of near and dear to their hearts. So just quickly in terms of how I've structured my presentation is I'll give a kind of a brief overview of the paper itself, just to provide some context. I'll share some observations and then some ideas to take forward that have emerged from the paper. And I'll keep sort of the presentation at a high level, and we'll save the discussion of specific examples and cases for our panel discussion later on. So I think as Ruth noted, the paper aims to explore sort of evidence to policy partnerships really as a one kind of tool or a mechanism for strengthening the demand for and use of evaluation evidence in decision making. And if you bring sort of a systems lens to this, like the demand side really is about strengthening capacity, at all levels of the knowledge system, right? It's the individual policymaker level, it's organizational supports and systems, but it's also institutional sort of norms and mandates. And the paper follows on the heels of a 2020 UNU wider paper that, as Ruth also alluded to, reviews the progress of development partners in generating and using evaluation evidence. And while the paper found that we're making progress in the quality and number of impact evaluations, the authors pretty clearly conclude that we need to do more work to ensure evaluation findings and recommendations are used in policy and practice decisions. And I think two of the report's findings in particular were relevant to this paper. The first, that donor financed and commissioned evaluations, and those led primarily by investigators who are from the North, underplay the need for local ownership. And the second, that development partners place limited emphasis, on strengthening country level capacity to produce and use evaluations, right? So in a sense, the paper offers these evidence to policy partnerships, as one way to address some of the challenges raised in that report. And what I wanted to do with this paper is call attention to to highlight the value of partnerships in advancing evidence use, right? Because to invest in partnerships, we first have to see them and understand their value. And while the importance of partnerships and relationships may seem obvious to most, right? The absence of partnerships or a lack of engagement between researchers and policymakers is among the most cited barriers to evidence use in the literature. What I found through my conversations and research is that we aren't investing in partnerships in a way that acknowledges their importance. So there is an opportunity here to sort of rethink how we invest in them and structure them. So how, as I get at, try to get at the paper is by exploring sort of barriers and enablers, the incentives for partnerships, and by digging deeply to understand partnership dynamics and what makes for an effective partnership. So before proceeding further, I want to offer sort of the definition for partnerships as used in the paper. So we define evidence to policy partnerships as spaces that allow for interaction and systematic collaboration between evidence producers and decision makers to inform policy and practice decisions, right? As distinct from one-off engagements, databases or portals, in that they are structures, they are kind of a fora, a platform that are designed to support ongoing collaboration and communication, right? So it's a program, it's an institution, it's a network, it's a community. A partnership is not the policy engagement workshop that you might have at the start, the middle, or end of your research project to ensure that your findings are taken up. Right? So I just wanted to offer that definition. And the motivation for partnerships reviewed in the paper tends to be threefold, right? It's, first, to foster collaborative and co-creative research to improve access to evidence and improve the likelihood that findings are used, right? Again, this is in contrast to research that is conducted, based on a researcher or a development partner's understanding of priorities without true consultation. It's to create processes for systematic use of evidence, right? Where there is a commitment to strengthening capabilities and structures for evidence use. And third, it's to build credibility and transparency in the policy process, right? Through a sharing of data and findings, whether good or bad, right? And creating a space to dialogue and debate this. And all of this, with the ultimate aim of giving evidence a more prominent role in policy and program and implementation decisions. I think that most people would agree on the value of, or importance of partnerships, at least those of us working in the evidence space and evidence community, and even consider it obvious, as I noted earlier. I think at the most basic level, through these partnerships, governments can gain access to evidence and specialized expertise and research methods. And researchers and funding partners in turn, right, can benefit from the insights that they gain about policy windows, right, and the access to, data sets, administrative data sets, and other kinds of data to help answer research questions. But as I note in the paper, right, partnerships can only really play a role in strengthening the use of evidence, when the incentives or motives for engaging in the partnership are aligned across all of the relevant partners, whether government, research or academic partners or funding partners. And I've listed a few areas where there can be misaligned incentives. I won't speak to all of them, but maybe I'll just highlight a few, right? So incentives can be misaligned when there isn't enough of a commitment to ensuring, partner priorities are centered. And I think, we haven't been great at this as a development community, but things are starting to shift. And there are many promising partnership approaches that demonstrate this in the paper. You can have, misalignment when program budgets and timelines don't do enough to support the relationship building aspect of a partnership, right? So you have budgets that are too small or not flexible enough, and timelines that might be too rigid or too short. Incentives can also be misaligned when the capacity needed at all levels of the knowledge system, as I noted earlier, to influence evidence use isn't sufficient enough, right? So research is challenged when you don't have basic data infrastructure in place, for example, right? And decision maker ability to engage with evidence is also challenged in the absence of organizational supports and institutional norms and mandates. So moving next quickly to kind of a few key observations and partnerships approaches that correlate with these observations. I won't, again, get into specific examples, but kind of welcome everybody to read through these and to engage with the paper and invite continued discussion and dialogue there. But I'll just sort of mainly speak to some of the key observations, right? The first is that, what I want to highlight is that partnerships are successful when they are built on strong relationships, right? And yes, policymakers are after findings, but they also want to be consulted and to actively engage in setting priorities, in co-defining research agendas, and in reviewing findings, right? And this is equally important to them. Again, this is quite different from the more passive communication and dissemination or policy advocacy approaches that many development programs still, I think, support. And from a researcher perspective, I think if you're working towards effective use of evidence, decision makers, as I just noted, don't want you to just show up with the research and your findings, right? You too need an engagement strategy and to form alliances that will help you understand priorities, the policy process and the context in which you are working, to identify windows of opportunity, right? And to also assess the capabilities that exist for the evidence that you are generating to be taken up and to influence policy and practice decisions, right? And as we know, I think true, collaboration and partnerships are built on trust, and it takes time to build that trust. And so the ideas that I offer for taking forward are aimed at getting at, what it might take to formally value and invest in the relationship building aspects of policy work. So the next sort of key observation is that, convening power is critical. For partnerships to be effective, they have to have convening power. And this is more than just, hosting a meeting. It's creating a space for dialogue and having the ability to ensure that, the right people are at the table as policies are debated and decided on, right? And, some ways in which partnerships are doing this sort of at a high level is they're creating neutral spaces for ongoing dialogue, like the Utafiti Sera initiative led by Tasker, and they are facilitating collaborative learning networks and hosting policy dialogues. The third key observation is that capacity strengthening is an important dimension of partnerships, right? And most of the partnerships that I reviewed in the paper do in fact have a capacity strengthening component that typically includes sort of workshops and tools to improve the design and implementation of evaluation. So, training and support for both people in government, but also for researchers, and also workshops and trainings on the demand or use side, right, to improve the uptake and use of those findings. But here I would argue that this isn't sufficient, and there is it isn't sufficient across the partnerships that I reviewed, and there is tension between sort of the focus on generating results, right, and influencing policy in the near term versus sort of long-term capacity support and systems level needs, right, to strengthen evidence use. And the final thing I'll say about this is that you can't, I think it's hard to have this conversation about, strengthening evidence use without really addressing very real capacity constraints, both on the supply and the demand side. And this isn't just like an issue in low and middle income countries. It's an issue, I think, that all countries face and experience. And so the third observation is that misaligned incentives slow progress. And I touched a bit already on where there can be misaligned incentives, and just some quick approaches for how sort of partnerships are addressing these, right? It's by embedding sort of long-term partnerships to work alongside government and deepen an understanding of local context, right? So in the paper, I give the example of ID Insight's work with the Ministry of Monitoring and Evaluation in Ghana, where they are working to sort of flexibly support the government's evaluation needs, right? And coming to the table with different tools and trying to kind of be adaptive in how they are addressing sort of the challenges that the government is facing. It's by investing in personal relationships to develop an understanding of government priorities, right? And to gain access to information about reform priorities, right? In one of the partnerships that I reviewed, the Transfer Project, there's mention of really the time that the partnership really spends on getting to know at an individual level government partners and counterparts, really to build those relationships. It's introducing requirements to ensure that research is decided on and designed with practitioners, as EGAP, or the Evidence in Governance and Politics Initiative, is doing. And so moving next quickly to some of the ideas to take forward that emerged from the paper. The first is to anchor evidence to policy efforts in country level institutional structures, like evaluation units or policy labs. And why I think the argument here is that country level institutional structures have access to senior leadership and decision-making processes. They have wide reach across government, and entering through these institutions could help anchor the focus on country-led evaluation agendas, right? But here I think it's important to think through how best to complement or partner with existing initiatives, so that as development partners, we have a way of easily identifying what these initiatives are, where there may be a need for additional support, and what different partners bring to the table. The second idea to take forward is to prioritize capacity strengthening, right, in our efforts to advance evidence use, and to do it in a way that begins to challenge power imbalances. And for example, right, by really focusing on building a body of country evaluation experts, right? To stem what has been, a kind of a traditional kind of one directional flow of expertise. And I've highlighted a few capacity development models in the paper that are trying to do this. I think this also responds to growing acknowledgement in the development community that it's the country level researchers and advisors with a close understanding of context, the context in which they live and work, that are best positioned to facilitate policy engagement, right? And another point I want to make about sort of the power imbalances is about the authorship of impact evaluation based papers and the important questions we need to not only kind of interrogate, but to act on, right? Like, what research is prioritized? How is it prioritized, and who prioritizes it, right? And here, just as an aside, I had a conversation with a research partner this week who was describing their research to me and said, I led, I designed, I did everything here, but I could not be listed as first or last author because the funding was external, right? So I think there's a real problem there that we need to not only begin to sort of interrogate, but really to start to act on. The third idea to take forward is to strengthen, coordination of evidence to policy partnerships. I think it goes without saying that the development community and partners, but we just need more coordination, right? And so one idea here is to really consider a formal structure for coordinating partners that are working with government on impact evaluations, right? And the partnerships to promote evidence use. So one example I give in the paper is the kind of local education group structure, where that brings together national governments and representatives from education, development partners, donors, teacher associations, civil society, to help set kind of priorities and to coordinate the kind of education initiatives in that sector. The fourth idea to take forward is kind of to think through, how we might change funding structures to support long-term partnerships. And this, speaks to the point I made earlier about, program budgets that, are too small or inflexible, and timelines that may be too short or too rigid. And that as a result don't accommodate, the relationship building aspects of partnerships, right? So the suggestions I offer here kind of really are aimed at valuing partnerships and giving them sort of the space and the resources that they need to grow, and really kind of acknowledging them as critical elements of the policy process, right? And I think to systematically promote co-creation, and do it in a way that allows for kind of iterative co-production cycles, that is just more than a start of a project performative kind of tick box exercise. We have to invest in this, right? And so some ideas here are to consider allocating a percentage of project budgets to partnership building work where relevant, and make it a routine cost like overhead or administrative costs, right? The second idea is to just build more flexibility into budgets, right? To move away from those rigid output focused indicators to allow grantees to more flexibly respond to partner needs and policy windows as they arise. The third idea is to fund projects just for longer timeframes to accommodate the complexities of systems change. I mean, we know policymaking is far from a predictable or a linear process, right? So we should think about funding in a way, I think, that acknowledges kind of what we understand about the policy process. And then the final idea gets at, I think what needs to happen kind of next in terms of how we understand and measure the impact of evidence to policy partnerships. So, what it means to embed evidence use in decision making, right, to make evidence use the norm, but specifically the contributions that partnerships make to this, right? And then trying to understand, kind of to unpack, which partnership models might be best suited for which policy questions and which contexts. And I think I'll stop here and just look forward to the discussion.
Great. Thank you so much, Abeba. You've given us a huge amount to absorb and a big agenda to pursue. So thanks very much. There may be questions for you, so don't go away. And as we start the panel discussion, I just want to remind the audience members that you can post questions in the comments on YouTube or on Twitter through hashtag CGD Talks, or send an email to events@cgdev.org, and somebody's monitoring those questions and will pass them along for the later part of the discussion. So now let's turn to our amazing panelists. Konstantin, it is so nice to see you. Thank you for joining us from Dar es Salaam. I know that you have been involved in many kinds of partnerships, research partnerships over your career so far, and really an active champion and practitioner around the use of impact evaluation for policymaking. Just general question, what from all the experiences you've had to date, what are the what are the lessons, what are the recommendations you would make, particularly to your peers in the research community, but even more broadly would also be welcome?
Thank you so much, Ruth, and everyone involved in organizing this. It's an absolute pleasure to sit in this panel. To respond to your question, Ruth, and I think to echo what Abeba just presented, I think my experience with Research Network, going back to the Center for Effective Global Action through the EAST program that I have been a continuous beneficiary of, but also with respect to the Network of Impact Evaluation Researchers in Africa, that is also another initiative that I'm involved in, and looking back at the work that we're trying to, since we started building in Tanzania in the impact evaluation space, I think I wanted to kind of echo one kind of clear thing that Abeba mentioned, or maybe two things. The first is, I think, the kind of longer term view. I think one of the benefits that I have continued to receive from being part of the SIGA network is that I think SIGA had a very long-term view about the need to build capacity within the research network in the continent, but also to kind of change the conference infrastructure, the research infrastructure away from just everything being in North America or Europe, but also to start being hosted in the continent. I think we oftentimes forget, and I think the pandemic has reminded us about how important it is to be physically in a room somewhere and networking over coffee, and that kind of network effect is very important for researchers in the continent that don't have access to that network, that don't even have a member within one of the hubs in that network to tap into. And so I think one of the things that we've been trying to push is to having and hosting more physical events in the continent to bring in the best researchers around the world in the continent. And I think the kind of whole infrastructure in research, from the funding organizations to the implementers to academics, I think moving some of those things to the places where we do research, I think, in that longer term view, it's of course going to be not definitely easy, but I think that's important. I think the second thing is, this idea of flexibility with funding. I think I've been a very big beneficiary of the Hewlett Foundation funding, for example, and the kind of flexibility that you get in terms of responding to evolving issues or negotiating. There's this other issue. Can we do this instead rather than that? I think is very important. And I think when you think about the whole research pipeline, it's often the case that an African researcher will almost never have the opportunity to set up their own research agenda. They're mostly responding to calls for proposals from various funding agencies, and very rarely are they in the driver's seat, even the local academics, right? If they're being invited by folks at Harvard and Yale and Stanford and so forth, they're being invited after a lot of the main questions have already been discussed by other PIs, or they're being discussed, even in writing. And then you invite this local researcher maybe because the funding organization is pushing for that, or sometimes it could be genuine demand from the the non-African researchers themselves. But still, it's never at the juncture of, okay, let's generate hypotheses. There's someone I know in Tanzania, or there's someone I know in Ghana who would be interested in this research idea, and let's start writing up the proposals, rather than at the kind of intermediate stage where you really, as a local researcher in the continent, you kind of feel, there's a tension between how much can I actually contribute to the research enterprise and how much is it just me being part of the team. And of course, I'll benefit from all the publications and so forth. But in the longer run, I think we need to move away from that kind of model to having the African researchers set some of those research questions and having to invite the Northern based researchers. I think that will, strengthen some of these issues, and particularly in terms of engaging with government. In places where governments are very suspicious of foreign researchers, it would really be a different kind of infrastructure and ecosystem, as Abeba kind of mentioned in her presentation, to have it come from government in conversation with local researchers, and then you have colleagues that you can invite in Europe and North America and elsewhere. And so I just want to kind of echo those kind of two main things on time scale, thinking longer term, and also flexible kind of funding. I think those two things I have benefited greatly in my career, and I think moving forward, if we continue making progress on those two dimensions, I think we'll make really good progress.
Thanks so much, Constantine. I really appreciated all the points, and particularly about the kind of intellectual ownership of the ideas is really a powerful thing for us to take on board as we talk about partnerships. Michael, really wonderful to see you as well. Thanks for joining. You've been involved in many dimensions of this. You're now sitting at Harvard. Before, you were working closely with the Australian government, setting up an embedded unit. You've seen many different dimensions of this. So would love to hear your thoughts about what you think the lessons are for researchers, for funders, and for government partners themselves.
Terrific. Thanks, Ruth. It's a pleasure to be here. And so I want to thank you for organizing this, the CGD. And I have to say, it was a total pleasure to read Abeba's paper. I think I'll recommend this to everyone. I think it's an important piece of work that should be widely read. So congratulations to Abeba. And I guess I have been, sort of thinking about this and working on this for a number of years. And I've been part of a bunch of failed efforts to incorporate evidence in policy in many instances, as well as I think having some success with the beta team in Australia. I think I wanted to emphasize some of the things that Abeba pointed out in the report that are, I think, most important in or have been in my experience. First off, I think just talking about how much of what has happened to date has still been in this sort of transactional form, looking for specific projects, sort of project by project collaboration rather than partnership, and how limiting that is given the incentives of the various partners. And I think this comes out well in the report. Academics, especially at leading institutions, really have an incentive to look for something that is innovative and potentially risky because it's new and untried, because that maximizes your chances of doing something exciting to the academic world that would be published. Funders often have a particular set of projects or programs that they're particularly interested in, and so that's limiting. And then officials in governments, typically have a bunch of policies or interventions that they've already publicly committed to, for which they have political support. And it's very risky to engage in new evaluations of those kinds of things. So looking for matchmaking opportunities given those incentives on project by project basis is very, very limiting in terms of how we get better evidence into policymaking. And I think that becomes very clear in the report. And that's the call, I think, here that's very powerful to move towards, a better, fuller kind of partnership. That's longer term and prioritizes the most important policy challenges facing governments in the developing world in particular, rather than the needs of researchers or funders. So I just think that's terrific. In terms of then the recommendations, the ones that were most compelling to me based upon my experience were in sort of 1 and 2 in the recommendations list. And this goes towards sort of directing more funding to the establishment of within government or sort of government adjacent evidence-making capacity. I think that is really critical. And so the report talks about creating evaluation units or policy labs within government and government agencies. I think that is a terrific idea. Very few government agencies in the developing world, even in the developed world, especially at the state and local city levels, have the funding available to create their own evaluation units and to do dedicated evaluation research in-house. So directing more resources to creating those kinds of units that develop the capacity to do good research based upon current priorities, I think is really critical. One thing to think about, I think, that could be supported from the academic side is this secondment idea, or creating a career pathway for junior researchers who don't necessarily want to be academic stars publishing in journals, but want to direct their research towards improving policy. And especially those who are coming from developing countries and want to go back and serve the government and the communities that are their home communities. Creating pathways for them to move into these evaluation units, I think, is an area where we could do wonderful things together. And that's something I'd like to work on with funders. This is kind of, and so, we're getting more researchers well-trained into government units. We can also focus on training civil servants as they are developed professionally in evaluation and data analysis. And that capacity work is sort of bottom up, creating the capacity and the interest in better evaluation. And then finally, sort of top down and longer term, I think, is thinking about the ways in which the policymaking process can be reformed over time to accentuate or emphasize the need for the best evidence. And we'll talk about this in a moment, I'm sure, but sort of the public discussion of what represents good evidence in light of the COVID, management of the COVID pandemic, has been sort of interesting. We have this model in public health and medicine for what is rigorous evaluation of some new piece of policy or some approved medical intervention or drug. Thinking about how that model can be more applied more broadly in the consideration of all other areas of policy is something we tried at Beta, and I think is something that we should aspire to in the future. I should stop there, Ruth.
Great, thanks so much for that. We'll certainly come back to you for a next round. Norma, wonderful to see you as well. And I think many people possibly in the audience as well as on the panel are indebted to the Hewlett Foundation for support of advancing this field in a number of different ways, and often in kind of courageously experimental ways. So really appreciate that support. Now, putting you on the spot, how do you think funders can respond to the call for the type of support that would permit all of these kind of range of productive partnerships that are being discussed? What do you think the kind of promising pathways forward are for the philanthropic community?
Thanks, Ruth. I think that we've heard some of the other panelists and talk about some of the first best solutions: longer term support, flexible support that enables evidence groups to respond to decision makers' needs, support for in-country organizations to really have time to develop their own research agendas and capacities. And also, we haven't yet talked about support in terms of bilaterals and multilaterals, doing the kind of things that Michael talked about in terms of supporting in-country evidence units. But I think what we all need to think about, and I think there are opportunities both for funders and for implementers to think about, is what some of the practical second best solutions are that meet different funders where they are within their constraints. I think that it's quite easy to feel hopeless around the funding environment. I feel that as somebody within a funding institution trying to change the broader field. I see other people within funding institutions feeling that about change within their own institutions. And I certainly see grant seekers feeling that. But I think that, all of these partnerships that Abeba pointed to, which exist, are signs that change is possible, and that change is possible in a range of funding institutions. So in terms of practically speaking, what this can look like, I think that there's an opportunity for funders and implementers to come together around the practical constraints of a given funding institution and what can be done within that. So for example, I have seen colleagues at Gates really lean into how they take a sector-specific pot of money, where within that the Gates Foundation has already set some priorities, like women's economic empowerment in certain spheres, and support longer-term work, such as what Gates has done in Kenya, to particular research centers advancing that agenda. And I've seen even smaller tweaks, such as work by Gates and SIF to build in some flexibility into specific research grants to adjust the work based on exactly how the policy priorities play out, as well as to give scoping grants to enable researchers, including African researchers, to build out agendas that can then lead to longer grants. And I've also seen some work in terms of willingness to invest in changing incentives. For example, there's a variety of US funders, led in part by Pew, that are trying to support universities, and exactly what Michael talked about, of how there can be more incentives around practical policy change, not just academic excellence. So I think what I would just recommend to closing to grant seekers is coming to funders with as much of an understanding as one can have of their constraints, and a series of options of what to do to move things forward. So for example, the Africa Center for Evidence recently came to me with a proposal to support a range of African research centers, understanding our constraints around writing relatively small checks to many institutions. And we were able to move forward to advance a series of body of work thanks to that would not have otherwise been possible.
Great. Thanks so much, Norma, particularly for those kind of specific examples of the ways that even within the real world, there are constraints that funders have. We often think of funders as being kind of all powerful and all flexible, but in fact, they operate within their own constraints, and how to, as you said, kind of work creatively to create the space for partnerships even within those constraints. And it often does take some creativity, I think, on the part of program staff as well as prospective grantees and others. And I think the same is probably true within the bilateral agencies that support research and evaluation, that there are ways to make the most of the resources. So, the reason we're meeting on Zoom and not over coffee, as Constantine suggested, is the best way to build relationships and learn from each other, is because of COVID. And I think that all of us, certainly I, sort of have during the COVID experience thought, well, if not now, when? If not now, when will we ever see the use of the best available evidence for the most consequential decision-making, not just about health, where there's, Michael, as you said, there are established frameworks, not perfect, but established frameworks, but throughout the multiple dimensions of response and recovery. So if not now, when? And fortunately, we do have some examples of partnerships and impact evaluation and evidence generation broadly being useful and used for by the policy community. So I'd love to kind of open it up. Constantine, I will start with you just to sort of keep things orderly, but love to hear from each of you about what you've seen in the context of COVID-19. And I'll just integrate a part of a question from an audience member about whether you've also seen any sort of partnership with civil society and with the population at large in the communication and use of evidence. So you can take any part of that. Constantine, over to you.
Thank you so much, Ruth. I think the most, I think, so one, I don't want to draw too much experience to Tanzania, because Tanzania was unique in the last kind of 12 months, as you know, with the former President Magufuli, whose posture was in some ways very skeptic of COVID. One of the kind of COVID denialism, including making statements, casting doubt on the efficacy of wearing masks, which thankfully, the kind of team of researchers, with Mushfiq Mubarak at Yale and others at Stanford have shown in Bangladesh that, there's huge benefits to wearing masks. But in any case, so I think Tanzania had been experiencing, I think the research landscape in Tanzania is a bit unique, but I think what did work well is where to realize, especially those of us kind of not working within government, is to realize that even within government, despite having a president, despite having senior leadership making rhetoric that is in some sense unfortunate, there were plenty of allies within government. There were plenty of people within government willing and excited and interested in collaborating on research, even as the pandemic was raging, even when you had a president who may not have been supportive of any research endeavors on the pandemic. And I think that has, because of his untimely passing earlier this year, and we've now had our first woman president, President Samia Suluhu Hassan, and she has shifted the policy implementation of wearing masks, procuring vaccines for the first time in Tanzania's fight against the pandemic. And so you start to see those allies that you had in government, even during that time when it was, in some sense, riskier for them to reveal their true preference. You start to see those relationships matter for now. If you're in, for example, those of us at the lab here at ESRF, we're thinking of proposing a series of interventions and evaluations around those interventions to try and encourage folks in Tanzania to go get vaccinated. The vaccination rates are, disturbingly very low. Even the ones that have been procured, very few people have taken them up. And what we are starting to see is that women are not taking it up as much as the men. The men outnumber the women 2 to 1. And so we're in discussions and proposing with several researchers, both in Tanzania and outside of it, to propose a set of interventions, very simple kind of behavioral kind of interventions, but some more complex ones as well. And I think what mattered in trying to work with government is that we never ever, betrayed our relations with them, even during a time when their boss was signaling things that were contrary to what they personally believed. And so I think one of the things that has helped us, at least, is to acknowledge that, government is not some kind of monolithic entity. They're human beings who populate government, and that personal kind of trust that you can build over years is very important to remain relevant within the policy scape, but also to be as helpful as possible despite the constraints that they were facing, right? So you have people in government who are signaling to you, hey, we would really love to get some data. We would really love to get some research information to help us, do the negotiations, to help us debate in our departments. And we're still getting these requests now in a landscape that's much more friendly to researchers. And I think it's because of the kind of, in some cases, decade-long relationship that the institution, ESRF in this particular example, has built with government. So I think, I think that's the most important thing for me, is that it's sometimes it's useful to be adversarial with government, especially if the evidence is very, pointing towards some criticism of government. But I think we often forget that some of the people who work in government may not necessarily reflect the preferences of the leaders in government, and to be mindful of that nuance when you're working and keeping up with those relationships.
Yeah, very, very helpful reminders, both about the power of the institutional relationship as well as the personal individual ones. and the variation for appetite of appetite for evidence across government, often, at least in my experience, more at the more, kind of technical and lower levels, and far, far less at the higher level, higher political levels, which can be somewhat in tension with sometimes the desire on the part of researchers and funders to influence high-level visible policy. Great, really, really helpful. Michael, turning to you, what have you observed in the sort of COVID-19 context? What's brought you maybe hope and maybe dismay, if you want to focus on that as well?
I think that's a mixed message, as you say, Ruth. I think, I shared the premise I think that you held, which was that, at some level, I think we think that disregard of evidence is almost something like a luxury that can be afforded by governments or societies in maybe normal times or on non-urgent issues, less existential issues. But when a threat of this magnitude came along, there would be a sense of realization that would be broadly shared that, to respond to this effectively, we need the best evidence possible. And we saw evidence, I think we did see some of that to echo Konstantine's point. I think there was, certainly in places like Australia and New Zealand, I think in the US and Europe too, there was a broader public discussion of the standards of evidence and what evidence there was to support different approaches, whether it be mask wearing or social distancing, or, work from home restrictions and so forth. And of course, about the vaccinations. On the other hand, as you point out, there was a lot of almost backlash that can be attributed to a certain set of leaders in the US but elsewhere, who almost took a position that was that expert scientific advice was something that should not be trusted and should be rejected. And we have, of course, simultaneously the social media revolution that has made it possible to spread misinformation or disinformation in a way that we've never had before. And so there's been sort of some signs of hope, but also some clear warning signals about things pushing in the opposite direction, making it more difficult to get good evidence informing policy. I took hope from Australia and New Zealand, where I was, Abeba in Australia was working on COVID pandemic management policies, helped to put together some rapid surveys to investigate, the impact of lockdowns and the rates of compliance with government restrictions and so forth, and attitudes towards those, how people were dealing, the possible impacts of those things. And there was, in general, I think, really good collaborations and partnerships formed between public health researchers at various universities and parts of the government like Beta that were informing the Department of Health and their response to the pandemic. To the question that was in the chat, I think I couldn't think of many examples, but there was a big focus on domestic violence in Australia, and the civil society groups that are have been strongly advocated for more direct ways to address domestic violence in Australia were able, I think, very quickly to work with researchers to assess the evidence on the impact of lockdowns on rates of domestic violence, and then to propose interventions that might, mitigate that. And so there's some evidence, I think, that there's more interaction with those civil society groups as part of these nascent partnerships that we're talking about in that experience. But yeah, some hope, some cautionary tales, but it's certainly, I think, the case that there's a general sense that that evidence has been critical to the responses in Australia and New Zealand, at least.
Yeah, thanks very much. And I don't know, Konstantine, if you were thinking what I was when Michael was talking about it, sort of like, well, maybe Tanzania is not so unique after all, at least the earlier political levels. and the vaccine hesitancy and the effect of misinformation as a driver of that really obviously global issue. Abeba, I'm going to give you a heads up that I'm going to come to you in a couple of moments to kind of dive into the question of capacity development and what types of skills from your work you've seen being valuable. But before that, Norma, I'm guessing that a fair number of the organizations that you and your colleagues support have been either well or poorly positioned to be responsive in the COVID related needs, and would love to hear from you what some examples are that have come out and maybe what you've taken away as a lesson from that.
Thanks, Ruth. I have overall been really heartened by how different members of the evidence community responded, often in very difficult personal circumstances themselves. And I think one example of this is in the cash transfer space. There's been so much work on impact evaluations about cash transfers. And many of the organizations that have done them have traditionally been very judicious and cautious about drawing conclusions. And when COVID hit and decisions about scarce social protection resources had to be made fast, I was really impressed by how essentially all of the large institutions that have done impact evaluations on this were willing to offer advice based on both existing evidence and also just based on common sense about what to do with limited resources. And I think we've seen that playing out in informing both COVID response, but also in momentum for things like Malawi's recent expansion of their cash transfer program, which I understand came in part because of the engagement that they had with groups like the Transfer Project and ID Insight in COVID response that was further building some of those relationships. And I think the other thing that's really given me hope is that some of the new tools that have been developed, some of which I think will be talked about more at another panel next week sponsored by CGD, have been really helpful in terms of new fast evidence that could inform the response. So for example, right after school shut down in Botswana, Young Love tested a really cheap remote education intervention in 6 weeks and was like, what is relearning from this? Saw it cut innumeracy in half, and then went on to track to what extent those results persisted in time and in new contexts, and is seeing uptake in India, Kenya, and beyond. So I think that's just an example of how both relationships and new tools have played off in terms of new evidence as well. Just quickly responding to the question about civil society, I think that this is an important blind spot for me and for us in the evidence community. I think there's all sorts of reasons to believe that public pressure has and can and should amplify attention to evidence, and that I don't see myself and enough of the partners that we work with attending to whether and how the whole can be greater than the sum of the parts.
Yeah, really, really very helpful. And certainly I think for us at ID Insight and broadly in the evidence community, this is a really important moment to kind of interrogate the fully elite theory of change that we've all, whether we said it out loud or not, have been operating under in many, many ways, and instead sort of, I don't know if the right word is democratize, but certainly open up the communication with, in both directions, the communities that have been failed by the systems that we're trying to change. Abeba, coming to you, you raised in your work the value of building capabilities in a whole range of different ways, and for funders of investing in that, patient, long-term work. And it'd be great to hear from you a little bit of an unpacking of that. What do you see from your work as kind of the core skills for a range of actors in all of the kinds of partnerships that we've been talking about?
Sure, and thanks for that question, Ruth. So I'll start by saying that I think we know a little bit about the kind of what works in terms of sort of capacity building for evidence-informed decision-making from the literature. So there are others, and I cite the example of the Building Capacity for Using Research Evidence, the DFID-funded initiative that has done a lot of thinking and work around, what capacity building specific to evidence-informed decision-making looks like, right? And some of what they share through their work and findings is that, it's really kind of, it's a combination of approaches, right? If we're thinking of kind of the whole system and we're thinking of individual, organizational, and institutional level needs, right? It's this combination of top-down and bottom-up support. And one example I give in the paper is, the example of the Department of Planning, Monitoring, and Evaluation in South Africa, where they have training courses for new entrants, but they also have like a consistently sold out training program for senior level deputy and deputy director general level leaders that is really around awareness building and, creating value in evidence-informed decision-making, right? So that, when those partnerships are needed, those relationships are built and there's an understanding about evidence use and evidence-informed decision-making. I think the other thing in the literature is that really kind of flexibly aligning support with government capacity needs is really kind of key to how we think about capacity development and support. And again, I think this comes back to really centering government priorities and research needs and aligning kind of the support that we provide with that, rather than coming in with our own notions about what we think, what type of capacity may be needed, right? And the second piece I think is like, I think at least in a lot of the work that I've been doing, there is the real value in peer and collaborative learning, right? And I think increasingly, like, this is how at least partners in government want to learn and want to learn together and want more of this sharing of experiences and collective surfacing of insights. And I think there's real value in that. And a lot of the examples in the paper, like there's the transfer project, there's a ID, EGAP also has a learning network, right? And these are kind of offer more of the learning by doing. I think there's still, a role and space for true technical support and assistance in the context of that. But I really see sort of the more kind of joint learning and peer collaborative learning as being something that we need to continue to elevate, support, promote, because there is real demand for that kind of learning from within the country context and government partners.
Great, thanks for that. And your last point is, very consistent with everything we know about adult education and learning, that it needs to be relevant to people's daily lives, needs to be experiential, and it needs to be social. It needs to sort of include interaction with peers as an ongoing part of it. So really very, very pertinent. Thanks very much. I think we can extrapolate to the kinds of support that's required for that, which is certainly not sort of the a one-off workshop. So Michael, I'm going to turn to you. You're among other things, behavioral economist. And, some of what we've talked about is a sort of a meta question. So some of what we've talked about really is very much around incentives and how to kind of nudge people to behave differently tomorrow than they did yesterday. So I'm wondering how you think about this, how you see the kind of potential for nudges to work to enhance the use of evidence.
Yeah, it's slightly in the middle level. We would often talk at Beta about how we had to nudge to get people to accept nudging, right? And I think it's kind of at that same kind of one step removed issue. I think I guess there's two kind of responses I would give. One is that goes to the question of capacity building. And when I was at Beta, one of the best things I think we did was we ran training courses in evaluation, mainly focused on randomized controlled trials, but also quasi-experimental data analysis. And these were 2-day courses that I ran in Canberra For civil servants, we did about 150 or 200 at a time, and we did it over 2 years, multiple times, across all the agencies in government. And they were mainly younger civil servants who were intrigued and interested, and this hadn't been part of their professional training. Most of them hadn't encountered evaluation methods when they were in undergraduate degrees. And I found that they were very mission driven. So go to the question of kind of motivation or intrinsic incentives, and this, from their point of view, like thinking of how they adopt these methods and use this evidence in their work within government to improve policy was something that fit very well with their sense of their mission, and so they became advocates within government, I think, for thinking about how to evaluate policies more effectively, and they were thirsty and looking for opportunities to do better evaluation and build it into what they were doing. So that was sort of from the ground up, from the capacity building ground up dimension that Abeba has emphasized in the report. From the top down, I think we have to be a little bit more strategic. I'll use the word strategic, and that is, what can motivate leaders to adopt something that could potentially be a little risky and may pay off in the future, but may not, may incur costs immediately, right? So some of the things that we talked about, and behavioral insights is a good example of something that that has an immediate payoff. This is innovative. You can think of this in terms of the digital transformation, and governments that are sort of reinventing, taking responsibility for reinventing government in line with the digital transformation. They're being innovative, and that has political payoffs immediately for them because they're seen as doing cutting edge work to improve government service. And so to the extent that we build into those things that are very attractive as part of the bundle, the sense that better evidence is used when we do this. When we apply behavioral insights, we run randomized control trials to test if they work before we scale them up. That was what we did at Beta. Like every new intervention that we work with you on comes with the randomized control trials. It wasn't the headline, the government wasn't signing on to do more RCTs. They were using this opportunity to be innovative with behavioral insights. The same with digital transformation. Every government is transforming to be better equipped to provide services digitally and communications digitally. And part of that comes with a new technology for A/B testing and rapid testing of communication strategies and choice architecture in online forms. And so I think that would be kind of one recommendation for me, is to build in our emphasis on evidence into things that are very attractive for leaderships, and so that they become part of that bundle as they do these things that are immediately beneficial for them.
Yeah, I really, really very, very helpful point. And I'm really glad that you brought up the potential link and the emerging work that's being done to connect new sources of data to kind of new pathways for measuring the net impact of programs or different interventions. Constantine, I'm wondering if you have any thoughts from your current work and about whether there are new, maybe administrative data sources or sources from transactional, transactions that might be useful for impact evaluation. Or you can take this question anywhere you want.
Right. No, thank you. I think to kind of echo what Michael just said. I think one of the things that I have experienced especially in the last year, and I co-authored a very short piece with Bilal Siddiqui, who's the director of research at SIGA, and Grieve Chelwa, who's a Zambian professor at the University of Cape Town Business School, around, in some sense, although I spoke about the importance of physically being in the room in terms of connecting local African researchers with the rest, there have been really great opportunities in the last 12 months as everybody has gone virtual for people who have traditionally not have had access to certain workshops, research workshops in the leading universities in North America and Europe, or certain conferences because they've been forced to go virtual. So, there are certain people who would have been denied visas or been unable to get funding to travel to those conferences have now had access. And I think one thing that the kind of gatekeeping individuals in these institutions is to understand, as we go back to kind of the physical thing, is there a world where we could have a hybrid where certain people can still have access to a certain virtual kind of workshop to get their kind of, access to that network as we're going back to kind of physical things. So I just wanted to kind of say that before responding, there are benefits to the kind of pandemic in terms of access, and I'm just going to paste the link of the very quick 4-minute read. But I wanted to also kind of say one other thing is on capacity building. This idea of capacity building in and of itself, I think, is very useful. But I think what's more useful, I think, for the training sessions, especially what we have observed in Tanzania, is that they allow for government officials to start to build trust with the individuals in the lab. They allow the government officials to engage in an academic kind of situation where you can talk about like, oh, I don't really believe that. I just don't buy that. Well, it's like, okay, well, let's try and work through it. Like, why mathematically, do you believe that a randomized experiment will give you the best estimate of, what would have happened to the treatment group had they not been treated? And so you go through that and then you start building, kind of technical faith in the science of the evaluation, but you also build kind of interpersonal faith with respect to, okay, these are people who care deeply about the evidence. They have convinced me that there are technical methods out there to have the best shot of identifying this evidence. And then it makes it very easy to have the government implement these policies because, the individuals in the training have already kind of built trust, not only in the science, but in the individuals that they want to work with. And so I think for me, I'm excited at the next kind of phase, the next 10 years or 20 years, in a country such as Tanzania, precisely because there's a lot of donors, the World Bank and others are investing a lot in data infrastructure in these governments. So the Tanzanian government is in a process of kind of harmonizing all their data in one kind of platform. And I think that's going to be very, very exciting for researchers. We are certainly excited at the lab. And I think it'll allow us to leverage existing data sets to do quasi-experimental research studies, to do RCTs as cheaply and efficiently as possible, and to have that kind of interaction between us, the researchers, and the government folks in terms of like, what do you find interesting? What do we find interesting? How can we leverage available funding and how can we leverage existing relations to be able to inform policy? And we're starting to do this in a big way. We're trying to tackle vaccine hesitancy, but we're doing it in various other ways. And I think it takes time. It's certainly not going to be very easy to build 100% trust all the time with each administration. But I think, going back to what Michael was saying about the examples in Australia, I think I think what the hope is that once we have that infrastructure set up, it becomes much easier in future rounds to interact with the government on leveraging existing data and coming up with new questions to ask that is very helpful for policymakers.
Michael, yeah. We're running a little short on time, so make it quick.
Sorry, jumping the queue. I just wanted to reiterate something Constantine said there, and just like maybe say a little differently. Is like, we think that the key to trust, right, is a sense of shared values and shared goals. And it's very, and it's very hard to get that if you're not getting together and talking about why you're doing what you're doing, right? If you just think, oh, I have an interest in this kind of test and I have an interest in this kind of, so if you get together and can talk about why we do what we do and we want to improve outcomes, and we're collectively trying to figure out how to do that, and the use of evidence is critical to that. So I think Konstantin's point about getting together in these fora and doing, having these conversations is critical.
Wow, absolutely. I mean, tapping into the deep motivation of what is this all for and finding the alignment with each other is so incredibly powerful. So with that, we have only 1 more minute. So we're going to do a lightning round, and I'm going to ask each of you, what is this all for? And I'm going to start with you, Abeba, just very quickly. Doesn't have to be the perfect answer, just quick. What is this all for? Oops, you're on mute.
I think more equitable solutions for everyone.
Konstantin.
Yes, I mean, I think, so I grew up in a development family where my mother and my older siblings were all involved in development. And I think growing up in the continent over many decades, you learn about the panacea each decade. When I was very, very young, infrastructure was all the rage. And there's a lot of money being thrown in infrastructure. And then when I was when I came of age, it was like, well, African governments are doing really poorly in terms of delivering this aid. And so let's not do big infrastructure projects. Let's focus on the human capital. And then, every time you kind of, you have this feeling that you're always behind because the next innovation is just out of reach. And then sometimes these cycles go back again. And I think for me, the most important thing and the thing that drove me to impact evaluation, to really caring about evidence, is that in a very confusing world where everything seems likely to the lay person, it's very important that we set up institutions that have public trust, where people can easily go to and have a curation of the evidence in an easily transparent manner so that people can make their own decisions. But if we don't have institutions that the public trust with respect to vaccines, for instance, in Tanzania, it becomes very difficult for a random Tanzanian to understand and filter through what is more credible evidence over others. And so I think for me, the goal of my career, and I think what this is all for, is to enable an environment that is less confusing than an academic workshop at TL, for instance. So I think that to me is the goal, is to make it as easy as possible for people to understand the evidence.
I think that's a pretty low bar, less confusing than an academic experience at Yale. We could probably push it up a notch. Thank you so much for that. Okay, continuing with the lightning round for just quickly. Michael, for you, what is this all for?
Yeah, I think sort of echoing what we said earlier, I think it's just about improving outcomes. There are urgent problems that need to be addressed urgently, and we can't do that if we tie our hands around our back collectively by not using the best evidence to solve those problems. And it's frustrating to over the years to watch these problems being discussed without any evidence being discussed, or with evidence being discussed in ways that are distorting and misleading. And just the faster we can get to better standards for public and political discussion of evidence and how to use it to solve problems, I think the better off we'll all be. And it should be nonpartisan and non-political in the sense that we collectively as a society all share an interest in solving these problems. And so, maybe big debates about the method for solving them and, the trade-offs that have to be made on the way to solving them. But I think if we can, fix our sights on the most urgent problems, public health, poverty, education, across the board, I think, this is the purpose here, is to use the best evidence to solve those problems as quickly and effectively as possible.
Yeah. Norma, you get the last word. For you, what is this all for?
Similar to Michael, real impact for real people. I think that, what the paper shows is that, and what the examples around COVID response show, is that some of these much longer term, much slower relationship building, trust building activities can really have tangible results in terms of that. And I think the next frontier is really us looking at our own evidence of which ones of these kinds of models are the most effective, and how do we lean in to those.
Great. Well, this has been a great session. Sorry, I ran over by a couple of minutes. Let's keep the conversation going at CG Dev, CGD, hashtag CGD Talks. And I think all of us are available through various channels. So really appreciate everyone's participation. And Abeba, the paper you wrote really provided a wonderful point of departure for what turned out to be a great discussion. Thanks to everybody who was able to tune in. Bye.
Thank you.